Hi, this is Crystal Shannon from Healing Pathway Community, Illinois, and I'm so excited to introduce our guest therapist that will be one of the therapists leading our Overcoming Anxiety May 24th walk, Antoinette Davis of Therapy Matters. Welcome, Antoinette.
Thank you. Thank you so much for having me, Crystal. I am super excited to be here, and I also appreciate the opportunity for sure.
Absolutely. We are actually waitlisted now. Um, People that have signed up are so excited about the two therapists that we have coming aboard. And I am super excited to be able just to spend a little bit of time with you. I know when our Vice President Maria introduced you to me, I was just blown away, even with the introduction, the amount of knowledge and the wisdom that you provided. I wanted to be a participant on the walk based on what you shared with me. So I wanted to just dive in so that people who have signed up can kind of get an idea of what to expect.
Absolutely,
The
I would be happy to.
yeah, the theme of this live stream was anxiety is not exactly what you think it is.
Mhm.
So I want to start with just telling us a little bit more about you and just diving in and with that question of why anxiety is not what we think it is.
For sure. So, my name is Antoinette Davis. I am a licensed clinical professional counselor and founder of Therapy Matters PLLC in Chicago, Illinois. I do all my sessions via telehealth, and this is a population that I do work with often. Anxiety is not what we think it is because sometimes when words and diagnoses essentially become trending on social media, there becomes a lot of misconception on what it is. I do trust that people know what their feelings are, but I do sometimes question whether or not they have the full scale of what anxiety is, if that makes sense. So, anxiety is not solely just this big, scary thing that comes and now it's ruining our lives, but it's actually something that our body is responding to. So, think of it as like a stimuli or something that's happening around us, and our body is naturally responding to it. I always tell my clients that feelings are just feelings, they are not good or bad, they are not classified in that way. But more so, the question becomes, how do I respond when I feel this feeling, or when I'm experiencing this feeling or this thing in my body, right? It's not the thing, it's the response to the thing that literally makes the world of difference.
Absolutely. So, one of the things that I did learn about you is that anxiety is one of your areas of expertise. Can you share a little bit more about what led you to focus on anxiety as far as your practice?
Absolutely. Turns out the people found me, and I identified a theme within the clients that I have worked with in the past, and even the ones that I work with now. There's this thing that tells us that we're multitaskers. We have to do all these things in life, right? We're all wearing multiple hats and multiple roles. And then, in addition to, I guess, economically, right, there are a lot of people who have side hustles, or they are small business owners. And so there are a lot of variables that drive us on a daily basis. But one of the things that I notice within the client population that I work with is literally this feeling of I feel like I'm doing everything right, but I'm not seeing the results that I want to see. It's impacting me in ways that I can't describe, right? And so for some of them, it's the overthinking. It's not being able to rest at night. My thoughts are always wandering. I feel nervous or worried, or this desire to want to control the outcome of situations because I mean, I've planned for it. Logically, I've written it down. This is what I've done, and so I'm not getting the result that I'm looking for. And so a lot of the clients that I'm working with are literally just trying to figure life out in a way that makes sense for them, but then also looking to build coping skills so that they are able to execute the things that they want to execute without that icky kind of feeling that comes along with it.
Absolutely. And being a church girl, growing up in church, and a woman of faith, we were told to put our trust in God and then walk it out in faith. But sometimes you want to snatch it, out of the Lord's hands and just be like, I got it. I want to
Mhm.
handle it. So I think it's a balance. that comes, especially if you are a person like myself that's a Christian, a person that, their lifestyle is just kingdom. It's just very important to have that balance. But then people that don't have that kingdom lifestyle, it may be a little bit hard for them. You'd be like, put my trust in what? Put my trust in who? I'm putting my trust in myself. And I think
Yes.
that's kind of where it kind of gets chaotic sometimes too, a little bit.
1000%, right? It's that idea of, well, if I don't have a belief system or if I do not believe in God per se, right? I know other deities and entities exist, but it's still that idea of, I want to be able to do this. I see it happening this way, and this is the way I want it to go. And sometimes our desire to see a thing happen a certain way can also kind of lead us down the path of feeling overwhelmed or feeling, we're gonna have to pause. Feeling overwhelmed, but also feeling out of control, if you will, because I'm not finding the peace that I'm looking for. I'm not finding the ease that I would like to see. I'm not finding the reassurance that I'm able to do this. And so sometimes we will try it in our own strength, for a lack of better words, right? Because I don't have time to wait on God. I don't have time to wait and to pray and to see things change. I want to be a doer. I want to be a shaker. I want to see things happen immediately.
Piggyback on something that you touched on that was very powerful. You said that anxiety doesn't always show up as panic. What are some hidden forms that it takes that some people often miss?
For sure. So sometimes our anxiety can show up as irritability. That is one of the big ones. I'll go ahead and say that it's me. I get irritable when I'm already feeling overwhelmed or stretched too thin, or maybe even overextended in my personal life. And so I will become irritable at some of the simple things, i.e., if my kids have the TV too loud, it's like, why is the TV on 1,000? And the truth is, I'm annoyed, I'm irritated already because I have not addressed or identified this thing that's happening with me. And so now my response to and towards everyone else can come off as me being irritable. It can also show up as gastrointestinal issues, right? Stomach discomfort, stomach cramping. It can feel like you're bloated. And yeah, it can feel like you're bloated in your belly because of the anxiety and the stress that you are experiencing. Sometimes it can be, the classical shortness of breath. It can be sweating. It can be heart palpitations or your heart feeling like your heart is beating fast. It can also show up as feeling, what's the word? It can also show up as overthinking, right? Ruminating on a thought. You've been in an experience or you've had a social interaction and now you're ruminating. Did I say the right thing? Did I word it wrong? I hope they're not mad at me. With the perfectionism, you'll see it. I want things to be perfect. I want them to appear in a certain type of way. I'm going to try really hard, but really what we're doing is adding more stress and pressure on ourselves to perform this impossible task of perfection. And really, perfect and perfection does not exist, right? But then on the other side, with the avoidance, it can look like I don't want to deal with the thing, right? It's too big, it's too scary. Or sometimes I don't know how to do it, and therefore I'm going to ignore it altogether, right? And so oftentimes our nervous system or our thought process will literally bypass doing the thing that we know we can do because we feel like it's something that's impossible to overcome.
Wow, such a great wealth of information. Um, I want to kind of close with one question. Again, we are waitlisted now, but people are just very, very excited to be part of your group as far as the therapy walk on the May 24th. Um, if somebody is feeling nervous about coming to the walk, what would you want to say to them directly?
I would tell them to not let their anxiety get the best of them. Being in group environments can really normalize your experience. You are not the only one that is nervous about it. You're not the only one who's coming by themselves. And I've never done anything like this before. But come out and just experience what it's like to, one, be in nature and just go for a walk, but then also to be around people who can relate to what you're saying. Getting practical tools and steps that you can have to kind of kind of help you navigate this on your own outside of the therapy walk. I promise we are not going to bite you. I promise it's not going to be super scary. It's going to be so chill.
Antoinette, this has been amazing. Just a snippet of what's to come on May 24th. Where can people learn more about your organization?
Yes, of course. You guys can definitely visit my website at Therapy Matters with an S, PLLC.com/info. If you go directly to the landing page, you'll have the option to learn more about my services. And then there will also be a link there if you're interested in booking a consultation or therapeutic services.
Thank you so much again, Antoinette. We are so ecstatic to have you on the trails with us on May 24th. And to learn more about Healing Path Community, you can visit us at www.healingpathcommunity.com. Have a wonderful night, and we'll see you on the trails.
See you guys.